decades, but I'm seeing it, and it's so urgent right now. So, yeah.
Thank you. Thank you so much, Jodie. You're seeing it, and you're living it, and you lived it. And I think we know what you're talking about in terms of at the family level, at the community level, at the city and state and country level. So, you know, being human and being together in this is really important. Thank you so much, Jodie.
Can I add one thing I just remembered?
Absolutely.
Sorry, really quickly. You know, there are a lot of, because I was so early in the history of the pandemic, but also early in the state of Nevada, there was a lot of hysteria, a lot of miscommunication, a lot of misinformation. And so I saw the doctors and the administration scrambling to find answers, making some knee-jerk reactions to me. And I have to say, Nurse Amanda, there's just one person who really changed this whole situation for me, because people are talking around you and moving you and poking you and taking your blood and looking at your antibodies and your plasma. And Nurse Amanda was the one humane person, and that helped change the 2 weeks that I was in isolation. And it reminded me, you need one advocate. Mm-hmm. Sometimes it's just as powerful as having a lot of folks, one person who comes to you every single day and thinks about you, looks at you, and talks to you. Communication and having one advocate is night and day. So when I think about what you do at GFP, and it's like those sessions that we have with our children, whether they're virtual or whether they're in person, changes an entire reality.
Mm-hmm. One friend, one advocate, one nurse. And thank you, Nurse Amanda.
Nurse Amanda, I love her.
Thank you. Okay, sorry, I'm having a little technical thing here. Okay. So, Mariam, we would love to hear your experience of living through and surviving COVID individually and with your family.
Yeah, so mine was in New York in the epicenter, and Jodie, what a different experience from what you had, even though we both had the same thing, right, in terms of the virus. It manifests differently for everybody, and it certainly did in my household. So this is my family. That's me, my wife, my 5-year-old Amara, and Rosie, who's 10 months. So that was 1 month before isolation and the shutdown. And, you know, I realized that there was a lot of misinformation out there, and so we didn't know the signs to really look out for. I know the entire month of March, I was still going to meetings and socializing. I wasn't shaking hands. I wasn't touching my face. I know I was being so careful about it, but we have kids who like to lick everything, right? So it was virtually impossible for us to prevent it, even though, you know, us parents were, you know, doing everything we could. So we all got it. Similar to what Jodie was sharing about her immune system, my wife, Rena, she already had a little bit of a cold for 2 weeks, and, you know, we knew it wasn't COVID, right? But it was that weakness that I think created a perfect host for this thing. And so so she got it the worst. The Monday, so Monday, the 16th, March 16th, isolation began. Rena started having symptoms on Sunday evening, and she had a fever, a very mild fever. She hasn't had a fever in 15 years. So that was the first moment where I said, okay, something's up. That Saturday and Sunday, we saw 9 adults indoors, no hugging, no touching. All 9 of them got it. So there's a lot of guilt with that. But in the same way, like, there was a lot of community there too. Those people who had it weren't mad at us. They were, you know, leaning on us to have this conversation with, because they didn't know other people at the time who had COVID. And so it was a really strange bonding moment for us between these people. We saw 2 other adults that was outdoors, and they did not get it. Again, no hugging, no kissing, but they did not get it. And so, you know, the fact that we had to the announcement went out that we're wearing masks now, that should have been done a long time ago, because I know there's aerosolized particles, and Dr. Rachel can talk better about that, but this is different. It's highly contagious with the flu and cold. Like, how do you see 9 people and you don't touch them and they all get it too, right? And this is different, and there's still a lot of messaging, and I don't know how this thing became a partisan issue, but it's most certainly different. And I realized it was different when the next day, that Monday the 16th, I started having a mild headache. And that was there for a few days. A strange thing happened where I was in complete denial about this. I think I'm super person, nothing's gonna bring me down. I work out, I eat right, and I have a household to manage, so I wasn't gonna get sick. And even if I did, I would fight this thing. It's no big deal. And Chris Cuomo was saying this yesterday, and I totally related. He said he got a little cocky, and I think there are moments where this comes in waves. So there are points where, like, I had the flu in January, and I thought that, like when I had that, I was sick in a different way, where I wanted to pop like Dayquil and NyQuil and sleep it all off. Like, this isn't like that. There's really no medicine that you want or you crave to take this away. It's just there. It's lingering. It's a central nervous brain thing. It's different. And soon as the no smell and no taste, and that came so much later, I think like 45 days later, I saw a New York Times article. I ran to the kitchen and I smelled garlic and vinegar, and I couldn't smell it. And I was like, okay, I got this. And I was in denial about it. I didn't tell people. I didn't feel like there was a lot of love and community around this, because I felt it's so stigmatized. I felt like people were going to look at me like I'm diseased, or somehow it's my fault that I got this thing. I wasn't responsible. And that was hard emotionally going through that. My wife, Rena, for medical care, she went and she had a couple of virtual appointments. One was at 3 a.m. She had to set the alarm for it because she couldn't get an appointment. And, while she's on having the appointment, she's nursing our 10-month-old. And the doctor's like, you can't do that. Or like, wear a mask, quarantine yourself. And we're like, no, we've been all around each other for 2 weeks. Whatever we have, they have. And so the little one, the 10-month-old Rosie, she had a fever for one night. We freaked out. She's so tiny. I didn't know how she was going to survive this thing, but apparently their immune systems are still growing. And so they're not really a hospitable host for this thing. Kids still do get it, but it's on average, maybe not so bad. So she had it for one night. That was it, end of it. Our daughter, Mara, in retrospect, I started thinking about it. She complained of a mild headache. It didn't take away her energy that entire week before schools closed down. And so I was angry. Why did it take so long for the schools to close down? So again, medically, another thing I recommend for somebody to get if they're having respiratory issues is this pulse oximeter, oximeter to measure oxygen. So mine's at 99, which is good for oxygen, right, doctor?
Yeah.
And then the number above that is heart rate. And so this saved us. For me, when this turns respiratory, it's a dangerous thing. That's the scary point. We were told this is at the time where there wasn't a lot of information out there, and we were told that it's just going to plague the sick people. And we're not sick, we're healthy people, and Rena developed pneumonia. And so, we are in a position of privilege too, because we have 2 doctors in the family who we've been talking to. They're both of them separately, who don't know each other, told us to get this thing. I never had respiratory issues. I never had a cough. I never had a fever. It just seems like between us and the people that we know who got sick, headache was a common thing. Anyway, this saved us. We went into urgent care. Again, a lot of stigma, people telling you stay home, stay home. No, you go get help if it's getting worse, right? You know yourself. And so that's one of the things I learned, to be an advocate for myself when I don't want to keep telling my gut to shut up. I want to trust what was going on. And so Rena went in urgent care. We had the right language from the doctors in our family. And we just said, you're not our doctor. We want an x-ray. And they didn't want to give us an x-ray. And so we demanded it. We got it. And then their tone changed. And they're like, okay, you have this COVID pneumonia. They ended up giving Rena a COVID test. They didn't want to. They said they're going against CDC guidelines and not to tell anybody. Are you kidding me? And so we're like, just give us the test. And they did. And then we got the results 9 days later. Like, okay, we're recovered by then. But look, the good news is they put her on antibiotics. She was able to have the amoxicillin, which isn't as powerful as some of the other ones they're recommending because she's still nursing. So that worked in her case. I had the antibodies test to confirm that I did indeed have it. I know my kids had it, but I don't think there's any testing for that yet. So I would really recommend having these because, as my uncle put it, he's been treating COVID patients for 6 weeks in another country. You don't want to go to the hospital when you're gasping for air. It's too late. And then you play this game, like people are going to think I'm bad if I go get help. You know, it's for really sick people. What if that's you? You know, so really be your own advocate. And I just felt a lot of judgment from this, and I still do. And so, you know, Jodie, I didn't find out you had it until you were recovered. You didn't find out I had it until I was recovered. I didn't tell Jean about it until the last few days of it. You know, it's like I just didn't feel comfortable with all the stigma. And so it reminded me of the judgment that the LGBTQ community faces, that, you know, the people who work with the Gender and Family Project face. And it just took me back to that. And I was like, oh my goodness, if I don't share my story, I'm staying closeted, and I know what that feels like. And I just had to put it out there. And, you know, I'm trying to give my COVID plasma. I'm trying to, you know, do shopping for my building and for other people because, you know, I have these antibodies. Some people think I'm still shedding it and still judging. When people behave the way I don't expect them to, I'm reminding myself to just find that love and kindness, because being LGBTQ, you know, being raised in an immigrant society, there wasn't a lot of love in the sense of non-judgment. And because I'm different, that created more love in me. It's the best thing that's happened to me. And so now I'm using this as another experience to say, okay, they don't get it. So like everyone is responding to this differently. There's no right way to be or to react. And when we all come out of it, we could look back at it. But until then, I think a lot of us need therapy.
You brought up a lot of medical questions, right? Like, what's the right moment? What should families do? How do you handle this? How do you keep yourself safe and alive and keep your kids alive too? So Dr. Bluebond-Langner, would love to hear your thoughts on, you know, what should families do when they suspect or know that a family member has COVID-19 at home, and then also, God forbid, if someone needs to go to the hospital, what to think about.
As Jodie and Mariam both pointed out, we're still learning so much about COVID-19. What we initially thought was just a respiratory illness. We now, as they both have pointed out eloquently, that it affects more than just your lungs. It can affect your neurologic system, it can affect your heart, it can affect how your blood clots even. And there's a huge inflammatory process that occurs as a part of this virus. The other thing that we're learning more about is how it's transmitted. So is it transmitted through groceries? Is it transmitted through touch? Is it transmitted through respiratory particles? And how do we protect ourselves when caring? How do healthcare workers, how do essential workers protect themselves? How do we protect our family members? And truthfully, all of this is evolving and changing. And because it's evolving and changing so quickly, it can seem incredibly confusing and quite frankly, hard to keep up with. So what is appropriate PPE? What's appropriate in PPE, meaning personal protective equipment? So how do you protect yourself at home is different than the way you protect yourself in the grocery store, is different than the way you protect yourself when caring for somebody in the hospital that may be COVID positive. And I think also, both of you have brought up, there is this need and desire to get medical care. but seeking medical care can put you and your loved ones at increased risk. So in other words, going out, you have more